Hi, and welcome back to the Dr. Ramsey Show. You all know that I am really passionate about what I do as a living, and I've been doing it now for 26 years. I have the pleasure of introducing you to some new providers that are now studying with my teacher, who I've been studying with for 26 years, Dr. Neal Rouzier. He is the reason I know all of the research that I know, why I am so confident in what I do with patients. I'm so grateful that these two providers are going to be joining us. You already know them. We're going to introduce one to you today, and I'm going to introduce Dr. Colpaert, nurse practitioner, who's going to be working at Revitalize with us. Welcome.
Hi, everybody. I think most of you have probably met me. I've been at Revitalize probably the last 2 years. I started out in the lab as a nurse while I was in nurse practitioner school. And I most recently have been sitting in Dr. Ramsey's visits as her assistant and nurse practitioner in training, essentially. So you may recognize me, but I just graduated from nurse practitioner school, family nurse practitioner, a couple weeks ago, actually. Pretty interesting take I have on everything is I just received this conventional training, but I have a real passion for functional medicine, kind of what brought me to Revitalize. And as Dr. Ramsey said, myself and Taylor, who you'll meet, just finished a training with Dr. Ramsey's teacher from 26 years ago, all on hormones, which most of you know we specialize in, and it truly was life-changing. Just everything came full circle for me.
Mm-hmm. And the first day, Dr. Rouzier talked a lot about confirmational bias. Mm-hmm. And what that means is, let's say that I'm a cardiologist. I learned that statins reduce cholesterol, statins reduce heart disease. That's my tool. The other tool would be surgery, and that's about it. So it's hard for practitioners who study conventional medicine to really grasp this and to appreciate it and to do it competently, because it goes against everything that we've learned. However, Dr. Rouzier and I both feel if this was the medicine of aging, if everybody started to take hormones at 40, we would not see the illnesses that we have today. So we have to be open-minded. And Dr. Colpaert is open-minded because she wants to do the best thing for her patients. And she wants to see them coming back better every single time. So I know that really hit you, that confirmational bias that he talked about.
Yeah, and the difference is, I think if you were to go into a conference like that with no training on hormones whatsoever or no awareness of the functional medicine realm, it could be a little bit of a shock. But for me, kind of what I was saying, it came full circle because I've been watching Dr. Ramsey treat patients for the last 2 years and seeing patients come in with all these horrible symptoms related to their hormones not being optimized and seeing what power hormones really can do for our patients, and then getting to go to the conference and really dive into the science behind it, knowing this isn't just something that Dr. Ramsey decided to do. It's really based on the literature that's very robust. So for me, it was just I was able to put aside some of that confirmation bias and really accept that this is not only where I'm meant to be, but where the future of medicine is meant to go. Absolutely.
Yeah. Between hormones and peptides now, it's like we can pretty much treat everything.
Yeah.
From the functional perspective, which is just, as I was trained as a nurse too, cracking chests and fixing hearts, it's so much better to prevent than it is to repair.
Yeah, it almost feels like you're essentially going back to the basics. In conventional program, which I won't knock on because I learned a lot of things, it's all about treating, throwing something at your symptom, versus what we do here is looking at why you're experiencing that symptom. And so much of it is that I've learned from Dr. Ramsey is because your hormones are not optimized. So when your hormones are imbalanced, your body is not working the way it's supposed to. So that's why you're having those symptoms. So really diving into that why and finding that root cause for patients is so important and something I'm really passionate about.
Yeah, and you're really good at it too. You're very good with the patients when you go over their patient plans. So I see you already doing it.
I'm excited. Yep, very excited.
So Dr. Colpaert and Dr. Lofton are going to start in July, and I'm going to oversee them. And you're going to get the same exact care from all three of us. Nothing is going to change. I'll be in the beginning, I'll be in at the end, but you're going to get exactly the same care. And that starts in July, and we all work together as a team. So what else did he say that was interesting?
I think it's just a lot of times people think about, okay, I really want to go on testosterone because I want to get muscles and have a better libido, which those things are amazing. Of course, we all want that. But there's so many long-term preventative type of things. It's all like a trickling effect. You know, the testosterone helps you burn your fat, which is that visceral fat, which can lead to heart disease. And when you have some of that fat burned, it helps your heart. It helps prevent cardiovascular disease, helps prevent diabetes. It's just kind of when you, like I said, dive into it, you see the trickle effect and how it's really preventative medicine. Yeah, we're treating those symptoms you're having, but starting early and being persistent, you're going to prevent some of those symptoms that we see are most prevalent.
Yes, and all we're doing is giving back the hormones that we can't make anymore. So, you know, we have a very young menopausal woman today. She unfortunately she's not ovulating. So we now have to treat her as a menopausal woman. But at least we get to help her. And that's the beauty of this.
Yep. Help her to age in the best way that she can and optimize her body to do what it's meant to do.
And what Dr. Colpaert said is starting as young as you can because we don't have the disease process starting. Can we treat someone coming in at 80 years old for hormones? Absolutely. It's very safe. We may not get the full results because they've already had some damage in their vessels and their organs. So that's why we say start early, but you can start really anytime, safely.
Yeah. And that's something I'm really passionate about is, you know, maybe not everybody needs to be on estradiol, for example, if you're not menopausal, we know, but there's a benefit still to coming in young and getting a baseline of what your hormones look like and understanding where you're going from here and making sure when you have these symptoms, you know where to go and talking about things that can harm your hormones. Like endocrine disruptors in our environment. There's just so many things that I'm looking forward to educating patients on, and Neal just really brought it full circle for us.
And these two girls have big hearts. They care, you know, just like I do. So you're going to really get the same treatment from all three of us. And thank you for welcoming them to our practice in July. Yes, they've been here as nurses, and you've been great with them, and now they're going to be providers with me. So thank you so much for listening and for meeting Dr. Colpaert and hearing about all the research that we know, and for then seeing them with me starting in July. Have a wonderful week. We'll be back next week with Dr. Lofton. Bye-bye.